What a fantastic conversation on African diasporas. As already said, I'm Jason Marzek, Vice President, Senior Director here at the Atlantic Council and our Agent Arch Latin America Center. At this consequential week, world leaders are meeting to discuss solutions to the most pressing global issues. And that's why we're bringing together diverse, influential voices to chart the way forward on one of the defining challenges that the world will continue to face, which is the health economy nexus, which is absolutely important. The COVID pandemic was one of the most challenging and defining moments of our recent history. We all remember that very well. The millions of deaths that it caused around the world and the cost of the global economy are still being felt today. The pandemic was also eye-opening in many ways, but it also demonstrated how interconnected health and economy have increasingly become. Let me just put that in context a little bit. A McKinsey study estimates that health improvements could add $12 trillion or 8% of global GDP by 2040. So that translates into a 0.4% faster growth every year through health improvements. It also suggests that focusing on health improvements could deliver incremental economic benefit of $2 to $4 for each dollar invested. These are absolutely impressive numbers. So there are significant economic benefits. To further explore these benefits, I am absolutely thrilled to moderate this conversation on the health economy nexus with four incredible speakers who I will introduce now. In the middle, Andreas Schaal. Andreas is the Director for OECD Global Relations and Cooperation, as well as the OECD Sherpa to the G7, the G20, and to APEC. He's responsible for OECD's relations with Brazil, China, India, Indonesia, South Africa, as well as Southeast Asia, Latin America, and the Caribbean, Southeast Europe, Eurasia, and the Middle East and North Africa. Andreas, you live on a plane, I guess, with that. But I understand you will be moving to New York for a brief stint. On the far left is Päivi Sillanaukee. Päivi is a special envoy for health and well-being at the Ministry of Social Affairs and Health of Finland. Great to have you. She previously served as Ambassador for Health and Well-being at the Ministry of Foreign Affairs, Director General, and also Permanent Secretary at the Ministry of Social Affairs and Health, Deputy Mayor and Director, as well as she also represented Finland in the WHO Executive Board and served as first and third Vice Chair. Very impressive background. Päivi, great to have you on the discussion as well. To my immediate left is Tamara Schudel. Tamara is the Vice President and Head of Global Policy at Roche and also is Global Ambassador for the G20 Health and Development Partnership. In Tamara's many roles, she's worked with policymakers, patient groups, academia, civil society, and also led the establishment of Roche's global health policy engagements with global institutions, such as the World Health Organization, World Bank, and OECD. Tamara, so great to have you on the panel. And finally, we're joined by Dr. Krishna Udayakumar. Krishna is the founding director at the Duke Global Health Innovation Center. He's focused on generating deeper evidence and support for the study, scaling, and adaptation of health innovations and policy reforms globally. So this is an absolutely well-rounded, impressive panel. And before we dive into the discussion, I just want to also thank and acknowledge, Tamara, I want to thank and acknowledge Roche for your partnership and support of this important Global Future Forum. Over the next 45 minutes, we'll look at health economy nexus, we'll look at the health innovation nexus, and then we'll look at partnerships and come away with some concrete examples for all of you in the room. I want to begin with looking at the fact that COVID was an extraordinary display of the underappreciated nexus between health and economy. I mentioned some of the McKinsey numbers at the top about the linkage between health and economy. Now, Andreas, I want to start with you. From your perspective from the OECD, why does better health not only lead to improved patient outcomes, but recognizing that this is an audience that not necessarily is focused on health on the day-to-day, why does better health also lead to better quality of life, but also drive economic growth? And if you could give maybe an example or two from your work of how you've seen that play out.
Thanks so much, Jason. You asked us to be brief, so I go with Twitter-style staccato. Message number one, thanks to Atlantic Council for bringing us together. Great to have this conversation. Message number two, looking at health only as a percentage of expenditure of GDP is too short. There is, and this is message number three, there is a two-way link between health and economy. We know that people with higher income are generally in better health, so life expectancies in higher income countries are also higher. On the other hand, healthy people contribute to more productivity and economic growth. This brings me to message number 3. This matters across the life cycle. Healthy children do better at school. Ill health impedes core skills development for adolescents and youth. Adults in good health are less likely to be absent from work, more productive at work, less likely to be unemployed. For example, and this is just about examples, we estimate that the economic costs of mental ill health amount to more than 4% of GDP. More than 1/3 of this cost is coming from the loss of productivity. So we also produced compelling evidence on the economic costs of risk factors such as overweight, alcohol consumption. I mean, this goes to me. So it's, for example, we estimate that overweight-related chronic disease dampened GDP by 3.3% and absorb 8.4% of the healthcare budget in OECD countries. So it's huge, and this brings me to message number 4. We need to have cost-effective interventions in the system to have because these have a high return on investment. Another example, our research shows that for every $5.6 can be saved for every US dollar invested in tackling overweight obesity. So I mean, getting me to run, getting me on the treadmill helps to boost GDP at the end of the day. Message number 5, and this is my last one, and then I give it back to you. There is also an important impact for health and jobs. So we observed that around 10.6% of all jobs are related to the health and care sector. Yeah. So this is also an avenue we should probably look at.
Andreas, those are excellent points. And I think you helped us to frame from the beginning why health can't be looked at in isolation, right? Why health is so much a part of the broader economy, whether it's school, workplace productivity, whether it's the benefits it brings to the economy writ large. You mentioned getting on the treadmill. We're all getting our steps in this week as part of UNGA week, so we're all hopefully getting a little healthier. Päivi, I want to turn to you. Some of the keys to the success in Finland in regard to how the healthcare system has helped to contribute to your country's top ranking. And I'll acknowledge the fact that this is now 7 years in a row that Finland is ranked number 1 in the UN World Happiness Report. So how does the healthcare system help to contribute to Finland's top ranking? And also if you could share maybe an example or two of that nexus you see between health improvements and the direct impact on economic performance.
Thank you, and thank you having this kind of discussion about health and beyond health policy for us, because this is really important that we discuss on health's impact on economy, but also security policies and trade policies as well. Why Finland is the happiest country in the world? I think that one major reason is that we have people-centered policy making in our country. So people are put in a center, and there is kind of we call well-being economy. So we think that if people are willing to contribute to your society, they also then it builds trust, which is especially needed now when we are in the data economy, and people then participate then by having coming to work, but also then are giving then data into use when we are developing new technological tools. And we have in Finland really comprehensive coverage of digital infrastructure. We have skills in people because we have the universal health coverage, health services are available for people, then also education is available there. So there is skills also a lot, and people are able to use digital tools, and the health sector has been digitized. So we can show in Finland what kind of effect then the new technology will have on economy and impact when you have really effective health system where the new technology is used, but also then what kind of contribution it will have then by giving possibilities to innovate there, because we have then ecosystems, we have legislation framework available to use the data in a safe and secure way. We have then then private and public sector collaboration and academic collaboration, and coming to the another concrete example, because one is then the whole society, how it works and how the system works when they use the newest technology there. But then the other one is that when you have then this kind of opportunities to work, deep dive the data, and do that in a collaboration with private sector. We, for example, have so-called FinGen project, where 13 pharma companies are collaborating with, and there we actually combine genomic data, fully sequenced genomic data to biobank information and health records and behavioral and socioeconomic records. And we have found, for example, new hereditary types of breast cancer, and then got people had genomic counseling there, and also calculated how cost effective it is to have that kind of counseling and get screening in early phase and avoid then cancer.
Thank you, Päivi. And I think one of the things you mentioned as well is that contribute to happiness is that the real people-centered approach that Finland has to its healthcare. Tamara, I'd like to ask you, why is this link between healthcare and economic growth so important? And maybe what are some examples from your perspective from the private sector of where you specifically seen health improvements having a direct impact on economic performance?
Thank you. Likewise, thank you to the Atlantic Council for hosting, and we hope this first forum is going to be a very successful one. So you heard already some of the links. Health and economy are deeply connected. If you get sick, if you get a disease that progressively gets worse, you may not be able to work as much. You may not be able to work at all. If you have a chronic condition, you may require a family member to take care of you. That person's work gets impacted, so they can't go back to work or work as much. Imagine if you are the primary caregiver, if you have little kids, elderly parents. So there's a rippling effect between health and the economy, not only how it impacts the patient, the health system, but also their family, community, and economy at large. Second, if we put that in the context of aging societies, we have millions of people living longer today than decades ago, and that's a great thing. And a lot of that is due to technological and health innovation. But as those societies age, we also see the burden of disease growing, especially in dementia, cardiovascular disease, cancer. That's going to require more resources, so we're not only impacting the health system, but also the economy at large. So we need to start looking at some of those solutions today to accommodate for all the trends we're seeing coming our way. So where can we start? There are a couple of things I just like to highlight. One, we need to recognize that half the world's population today doesn't have access to medical services, and 2 billion people have no access to medicines they need. So we need sustainable funding and financing for universal health coverage to make sure people can access the healthcare they need. Second, nearly 3 billion people in the world have chronic disease, and that's going to continue to rise, especially as the society continues to age. So we need to put a lot of emphasis on prevention and screening and catching those diseases early, diagnosing them, identifying, and treating them early. And I like to give an example in multiple sclerosis. Due to medical innovation, over 90% of patients after a decade can walk unaided. And over 75% or 3/4 of patients can escape disability progression. So just imagine what that means for their quality of life, that they can walk versus being in a wheelchair, that they can be an active member of society, continue to work. So it's critical that we catch those diseases early so we can give better quality of life to those patients. I will say putting a number on the economic impact can sometimes be really challenging. So at Roche, we are partnering with We4. It's an institute in Germany that's looking at measuring the impact of our innovations in retinal disease, in multiple sclerosis, and oncology, and the wider impact it has on the economy and society. It's not published yet. I don't have the concrete numbers, unfortunately, but I can tell you it's in billions across some of the major markets. And I'll just conclude to say that we do need to take action today. If we don't, our societies will get older, sicker, and poorer. And we can create a positive cycle where we have investment in healthcare innovation that keeps our populations healthy.
Well, this is why it's so important we have this conversation, right? I mean, we're here talking, this is the Global Future Forum, we're looking at the ideas and forces shaping the world, and oftentimes people don't focus on health until it becomes a problem.
That's right.
Right, and so we need to get ahead of it. Tamara, you're mentioning chronic diseases, the benefit of aging populations, but also the additional stresses that could place on the system. Krishna, from your perspective, do you see the political discourse and government action reflecting the true cost of disease and the implications on the economy? Do you see that this conversation among among politicians, among public policy, and if not, how do you need to bring this conversation more fully into the political discourse?
Sure. First, thanks to you and the Atlantic Council for the opportunity to join this conversation. I think the reality is there's a disconnect between all of the things that we've been talking about, what's happening in real life. You started off talking about the pandemic, and if you look at the economic cost of the pandemic, clearly above $10 trillion of lost economic productivity. And all of the data would show that we can buy down a significant portion of the risk of future shocks like that for $10 billion a year. You're talking about 1,000x difference or more. And yet, 2 years after creation of the pandemic fund that has a request for $10 billion a year of funding, we've raised a total of less than $3 billion across the entire global community. So we are very much in this cycle of panic and neglect, and very much into the neglect part of that cycle. The other things that we hear when we talk to political leaders is there's incredible competing priorities right now. We're seeing emergence of more conflict. We are seeing refugees that more and more countries are having to deal with. We are seeing food insecurity around the world. And those are directly competing for the same dollars that would go into health systems otherwise. So we have all the evidence that you can imagine, tremendous return on investment. It's not translating to political will. And I think that's where we really have to focus to say, it can't be a conversation about people who understand health data. Right. It has to now move to say, how do we create political will and political action? And I think part of the challenge with talking about the economic returns is those are often long-term. We can create productivity by saving a child's life today that they're going to live for another 60 years, which is amazing. And politicians have to think about cycles of 2 to 4 years for their political lives. So how do we translate this to short-term wins for politicians? And in turn, I think, as Päivi said, how do we make this much more people-centered? How do we create the demand from people that this is where they want their politicians to focus?
Krishna, I think that's absolutely fundamental. How do we build that political will? How do we show, again, beyond the political cycles, the importance of focusing on health, because it is a longer term issue. You're not going to have necessarily always the short term benefits, but also the linkage, again, between health and other issues that are often front and center for the political discourse, conflict, refugees, et cetera. We're here looking at the challenges, looking ahead as part of the Global Future Forum. There are many challenges that are ahead that are probably reflective of a lack of access to some of the best practices in healthcare. We were talking about population aging, worsening dependency ratios, especially in advanced and middle income economies. I think, Päivi, we were talking earlier that Finland has one of the highest aging populations in the world. There's growing social and economic burden of chronic disease, limited fiscal space. So looking into the future, I'm going to go back to you, Krishna. What is some of the cost of inaction and the potential impact for society and economy if we don't act on some of the issues we're talking about today, looking into the future?
Yeah, we're really at this inflection point where, if you think about, many high-income countries have taken significant public health measures decades ago and now are dealing predominantly with non-communicable diseases, huge rates of heart disease, stroke, but also dementia, things that are going to be enormous burdens moving forward. What we see in many low and middle income countries is this idea of a dual burden of disease, in that we're still dealing with the challenges of many communicable diseases, HIV, TB, malaria, which require significant public health approaches. And at the same time, because we've seen rapid urbanization, the development of middle classes, changes in lifestyle, and we're now seeing that there are large rates of non-communicable diseases in low and middle income country populations as well. And in fact, in just low and middle income countries, the majority of morbidity, mortality, deaths are caused by non-communicable diseases already. So we've got health systems that have not caught up and are not mature to be able to deal with the broadening burden of disease. So if we don't figure out now how we actually design future health systems in ways that are fit for purpose, and I would flip this perhaps and say this is the exciting opportunity ahead of us, is really to think about what would a leapfrogging model look like? What would the health system of 10 years from now look like? It's not going to be to build hospitals and build clinics. It's going to be to focus on a data economy. It's going to be based on creating much more decentralized models. And so I think we have now this opportunity where innovation can really lay the groundwork for what our future health systems investment
and
look
maybe,
like.
Krishna, especially for some of those middle and low-income countries that are dealing with these new challenges of non-communicable diseases.
Exactly, and so we're seeing, if you look at cancer rates, those are going to probably double across the continent of Africa over the next 20 years. If you look at dementia, especially, I think is going to be a massive burden that we don't have a real answer for.
Now, Tamara, from a pharmaceutical sector perspective, what do you see as some of the biggest challenges facing healthcare systems looking in the future?
I mean, some of the things were highlighted. I think it's this focus on short-term priorities, and health seems to be going down the priority list as governments grapple with all the other challenges they have to face. So I think we need to recognize the immediate challenges of today, but also look at some of the trends we talked about: growing burden of disease, aging populations, and fiscal pressures. We have to start looking what that means in terms of economic return today, but we do need a long-term perspective, and I think that is the most difficult piece. Yeah. It's how do we think beyond the next cycle, whatever the political cycle is, and I think how to get all the ministries and head of state to look at this holistically. Health should be everybody's business, not just a problem of the Minister of Health, but really the Finance Minister, Minister of Labor. They all have common goals to make sure they have a healthy population, big production and labor rates, no social welfare that has to be wasted. So it's really looking at a holistic picture for the system and the country. It is not easy, but for me, the question is not, can we view investment in health as an investment? I think the question is, can we afford not to, looking at all the challenges coming today? Yeah,
look at the challenges and looking at the impacts on the economy writ large. Päivi, Tamara was talking about the fact that you can't just be an issue for health, can't just be an issue for the Ministry of Health. It needs to be a holistic perspective. You're doing, Finland is positioning itself as a leader in health and well-being innovations. There's the RDI growth program for health and well-being that you lead. How is Finland planning, especially looking into the future, and you mentioned this earlier, but how is Finland planning to leverage its technological advances, international partnerships to address healthcare challenges, looking around the corner, and also doing so, as Tamara mentioned, from a more of a whole of society perspective?
Thank you. So keeping people active is, of course, important focus, because, as you mentioned, we are aging second fastest in the world after Japan, so it's really important. And a great achievement that we have got that into this position where people can age quite old and be members of the society. So it's important to keep them active, so and without any diseases. So here again, data and technology can help us both keeping people active there. But then we have been having a long-term vision since 2014. We actually have had this health sector growth strategy, cross-sectoral, where Ministry of Economy and Employment, which is kind of Ministry of Industry, Ministry of Social Affairs and Health, and Ministry of Education and Culture have been working together. And then this is fourth government who is then updating and also supporting it. And now we have also Ministry of Finance and Ministry of Foreign Affairs on board. So 5 ministries are there, and I'm coordinating that. We try to really look at from the broad perspective how technology can actually help different policies, health in all policies kind of there, showing that we have prosperous societies, and health and well-being sector is actually quickest growing sector. 5.5% growth per year is expected during next 10 years. And this field, health sector, is the last sector which is going then the digital transformation. So there are great opportunities then actually to provide then tools for more effective health systems and also for benefit of people. But we have to keep, and Finland is really, it's not only focusing inside Finland, but it is really important that we keep everyone on board. Also developing economies with us benefit all this what we develop in developed countries. And I see my friend Ricardo Laiti there, who is CEO of Health AI Authority, which then works with the UN organization, for example, to make it possible that countries could together then have safe solutions, because these technological solutions should be available also in other countries cross-border, and there we need really collaboration. That is a key
Well, I want to shift
point.
Päivi to collaboration. Talk, Andreas. You see practices around the world through your position, and my question for you is, how is the OECD helping to cross-pollinate, especially when you look around the world? We see shifting presidencies across G7 countries, across G20 countries, and how is that impacting some of the perspectives, but also the prioritization, which we've been talking about so much as part of this panel, the prioritization of the link between healthcare and the economy?
Yes, thanks, Jason. A very good point. Let me maybe just go back for a second to the financing question raised by Krishna and by Tamara, because I think it's really an important one to put the story also into context. I mean, we are falling $4.3 trillion short on financing the SDGs. We're falling a couple of $1 trillion short financing climate. And on top, you have fiscal situation in our countries which are not kind of conducive to kind of increase spending. And I agree with you that it's complicated to make the case for health, even if it's a case for investment. So that's why I want to make 3 points. And we are working in the G20. We have been creating, under Indonesia's presidency, the joint health and finance task force. So we had meetings with finance ministers, with health ministers. So we try really to bring communities together, and the OECD is supporting this with evidence. And I wanted to make three points what I think is crucial on the financing front. First, we need to if public finances alone cannot deliver, we need to look into ways to bring in blended finance, and this is something also the private sector. I know that many companies like Roche are very much engaged into looking into ways how also the private sector can leverage public money, and we need to have more public-private partnership in this respect. Second, we need to be smarter in the system. I mean, 10 blocks down the road in the UN General Assembly, we just, as we speak, we organized a panel on fighting antimicrobial resistance due to the overprescription of antibiotics. We lose a lot of money in the systems. It's not efficient, and it's at the same time, this even produces counterproductive outcomes at the end of the day, that we don't have a targeted use. So if we had a strategy kind of having more prudent or having more targeted prescription of antibiotics, we could save a lot of money which can be used. And the third element in this story is I could not agree more. We need to go further down the road to bring communities together. That's why I found it fun to accept this invitation today, because I'm not a health expert, but I'm dealing with G20 issues, and I really think it's important that we have this kind of conversation between global governance practitioners, the industry, the innovators, the artificial intelligence. I believe the digital story can be actually helping to have a smarter health system, and of course government representatives. So this is precisely the conversations we need.
And Andreas, again, we were talking about how to build political will. So how are you seeing that across G7 and G20 countries? Do you see any success or any key ingredients to be able to build that political will, especially with shifts in all countries?
I mean, to tell you the truth, I mean, the political will was huge when we were in the midst of the pandemic, because there everybody really felt that we need to act now. There needs to be there was this fund for preparedness, prevention created. I mean, you rightly point that it's not yet fully replenished, and we still, but G20 countries are working on that. I think this is something which was in the focus now. I mean, with the climate urgency, with the SDG urgency, there are competing
Yeah.
needs in the conversation, but we need to continue to make the case, as we did here on this panel, that health is an investment and not necessarily only a cost. And this is something which I think the pandemic helped to shift perspectives in policymakers, in industry, and in public-private partnership. But we need to continue going down the road, and it has not become easier with all the geopolitical situation around us. But as I said, there's, as Margaret Thatcher used to say, I never quote Margaret Thatcher, but she always said that there is no alternative.
Yeah, right, right. Well, I think health is also, I think, framing it as it's an opportunity. It's an opportunity for economies to be able to grow. There's also an opportunity to have that strengthen the nexus between health and innovation. What we're talking about today as part of our Global Future Forum is people, forces, and ideas shaping the world. And we think about some of the challenges, but there's also this opportunity for new solutions. Päivi, you've been speaking about technology being adapted in Finland insofar as a health innovation, but we're going to need even more innovations to be able to deal with some of the challenges coming across, and also the opportunities of the healthcare presents to our economies. Tamara, I want to go back to you. How does the life science sector drive? How is the sector driving health innovation and creating that value? And maybe if there's even an example you could share of innovations that have demonstrated significant value in addressing the challenges that we're discussing today.
Absolutely. So the life sciences sector sits at the heart of innovation. This is by nature what we do, and we're constantly looking at how can we innovate to make sure we're providing not only improved treatments, but really contributing to society at large by focusing on the highest disease burden and what needs to be tackled in the system. At Roche, this is a huge commitment for us, where we look at what are the key trends and where do we need to focus our research efforts. And that goes not only for innovative medicines and diagnostics, which is our core competency, but also looking at the health system and how can we partner to make sure the health system can absorb those innovations. If they don't get to the patients that need them, they are really meaningless. So there is a huge impact, which we already talked about, between health innovation and economy. I think we need to continue to generate evidence and have discussions in a different way. But for us, it's really important that a few policy factors are considered. One, we need to make sure that the environment we operate in incentivizes continued R&D.
Yeah.
And as you know, it takes a lot of money and a long time to bring a new medicine to the market. So we need proper incentives to continue to do R&D and make sure that intellectual property frameworks are protected as well. We need to continue to raise this wider value of innovation and continue to demonstrate the case for that, and also work together to make sure the health system can transform. So if we look at the next decade with the potential of AI and new medical innovation and technology, we can completely shift with how we prevent disease, how we catch disease, how we manage and treat it, but we shouldn't take that for granted. If we don't invest today, we won't get to that potential in the future. The funding and focus will go somewhere else, and it does require long-term thinking. So the more we can partner and collaborate to raise awareness and make sure the priority on health and innovation stays high, the better chances we have to leverage all those advancements going forward.
Thank you, Tamara. And I want to ask a question to the other three speakers on just a quick answer on what do you see, maybe a concrete new idea that you've come across that can hopefully help to drive greater health innovation and also drive that innovation in a way that it contributes to more prosperous, resilient, sustainable health systems, and also, of course, benefits the economy writ large. Maybe I'll start with you, Krishna, if you have a concrete new idea that you've seen that could really drive that innovation.
Yeah, and to build from Tamara's answer, I think the core of where we go forward is really this idea of health systems innovation. Right? Solving complex health challenges and creating economic productivity is not going to come from an app, and it's not going to come just from a technology like AI. So how do we create the policy environment where we're actually creating the data security and privacy issues, where we're dealing with intellectual property as well as technology transfer? How do we create financing? We've talked about there's no path forward with just public financing. So we have to use financing not just to say we need more money, but financing as a tool in innovation itself to think creatively about how to get resources into a system that's aligned. And then we've got to figure out not just the data, but what are the biomedical innovations that need to fit together what are the health systems delivery innovation, because the models of care, the workforce we need in the future are all going to look different. And the only pathway for sustainability is going to be for those things to actually come together. And that's really only feasible if we've got cross-sector collaboration.
Andreas, same question to you.
My good friend Amitabh Khan, the Indian G20 Sherpa, is always telling me, Andreas, we have been able to vaccinate 1 billion Indians within 6 weeks with our COVID up and with kind of distributing the vaccinations across the country. So, I mean, there is a case for technology to help us, and there are good ideas outside, and probably colleagues dealing with artificial intelligence can highlight this a bit more. But I also want to stress what Krishna has been saying. In order to get these technologies flourishing, we need to work more in an international environment on interoperability. First time that I was able to speak out this word, it's a difficult one. So
And you did it so well.
That's right.
So this is something we need to continue promote, and I could not agree more with you that the health, and Tamara, the healthcare systems need to go down the road of this paradigm shift to really combine technology, industry opportunities, and the patients' need. And if we go down this road, take this systemic approach, we're much better off.
Okay, so similar question to you, Päivi. So what we've heard so far, new idea can drive innovation, greater use of data, new rethinking or financing. And Andreas, you were also speaking beforehand about blended financing, technology, interoperability. Päivi, what do you see as a concrete new idea that can really drive innovation?
As we heard, structures, processes are needed at the national, regional, global level to be able to do this collaboration, research, development together. And then also, of course, policies, how we can implement them. This is really important that there is also the implementation and scaling up. This has been also very, very difficult to scale up then the innovations also. Then when we have these, the collaboration, international collaboration, agreeing on policies, regulations, so that the technology really can cross-border and not stop there, but cross-border. So that will then drive us and make us then, we actually have data, we actually have technology to use this, life science, biotechnology, everything. But then to do the shift from hospital care to more personalized care, prevention, to be able to have healthier populations. Now we have the opportunities, but we have to work together, and Finland is willing to show the way.
Well, thank you, Päivi. I think you really queued up my last round of questions here, which is all about working together. And that's actually what we do at the Atlantic Council, right? We work together, we create dialogue, we create collaboration, we do that all with the idea of policy impact. I'll start with Tamara. How do you see, what opportunities do you see to work together to advance health economy innovation? We've talked a lot about that as part of this panel thus far, but maybe even there's a success story you'd like to share of that type of collaboration.
Absolutely. I mean, we've done a huge amount together, and I think post-COVID especially, I see more and more collaborations and partnerships and a willingness to do so. No one can do this alone. Their challenges are plenty. So if I look at breast cancer, for example, in HER2 positive, there's been devastating for patients. And by working together and having new treatments, especially targeted treatments, we've been able to make sure that 90% of patients can remain disease-free after 8 years. And these women are not statistics. They're mothers, they're sisters, they're your coworkers, your friends. So it's really important that we work across the health system, patient groups, the healthcare providers that give medicines to the patients, that we all work seamlessly together to make sure that people who need them get them. And there's still a lot of more work to do. As I mentioned, half the world's population still has no access to medical services. An example of today, having discussions like this, making sure we're coming together and raising awareness and looking collectively for policy solutions is critical, and working together to leverage on each other's strengths. As an innovative company, our primary competency is innovative new treatments. But we also have so much expertise in our company, technical expertise, digital expertise, financing solutions and expertise. So it's looking at how do we leverage the strengths to really contribute to the system. And also being at the UN, we have a high-level meeting on AMR this week. Next year, a high-level meeting on NCDs. I think those are good starting points of setting the base of how we can work together going forward.
Thank you. Andreas, where have you seen the best opportunities to be able to work together across sectors?
I mean, the OECD is all about data, it's about evidence, and I mean, as we discussed here in this panel, there's already a good amount of data in the healthcare system, but it's still not connected enough in order to benefit from it. So I believe that there is certainly an avenue in better data interoperability. You see, it's getting
great,
more
yes,
complicated for the second time. So this question about how we better cooperate between countries in using this data and learning from each other, this is something we at the OECD stand for. We're bringing into the G20. I think this question about bringing different communities from finance ministries, health ministries, companies, innovators, disruptors together is something which is very important in this context, because we are a bit in a watershed moment where we can kind of define the policies for the next 20, 30, 50 years.
I think, again, that's so important. Päivi, you mentioned that as well, and Krishna. I mean, the importance of looking at health as far as an issue that goes far beyond just the health ministries, right? It's an issue that affects basically most ministries across governments. Krishna, what have you seen best ways to align public, private, international efforts, and maybe what have you seen as maybe an opportunity to be able to scale some of these wins of collaboration?
Yeah, I'd say if we can reframe the work we're doing, really that we want to improve the health of populations, and that can become the shared vision. And I think that leads to at least three very particular actions. One is we've got to do a better job of integrating public health and healthcare delivery. I think for almost a century, many of our countries have seen those as diverging fields. It's the same access to data, it's the same surveillance, it's the same systems. So we have to be able to create efficiencies between public health and care delivery as a path forward. The second is really to build on some of the principles of value-based care. So how do we actually align and pay people when they improve individual and population health, not for providing more services and more technology. And so creating more payment systems that are actually aligning to outcomes is the second. And the third is really going to be this idea that we have to fix end-to-end access. We've got dazzling innovation in the pipeline. We've got monoclonal antibodies and other biologics and long-acting injectables and AI-based solutions. Most of the world will not have access to those for decades. So how do we think at the R&D stage about what we need in terms of market-shaping forces to create access strategies? How do we start to invest in the delivery system so that there's equitable access, and at the end of the day, that's the only way we're going to create the trust in the system for communities and populations to come along with us.
Yeah, really important, Krishna. Equitable access and creating trust in the system. Päivi, I'm going to give you the opportunity for the last response as part of this panel, but I want to highlight again, and you've talked about this, but the incredible collaboration that exists in Finland between public sector, private sector, help to drive economic growth and improvements in outcomes. What have you seen in ways that can be advanced to drive that collaboration between research and development? Tamara has mentioned the importance of R&D, but between research development and also innovation operators. How is Finland advancing that collaboration? And what might be some lessons for other countries?
I think that trust is in the core. So we have to build then trust between different sectors. Academy, public sector, but also then private sector at the policy level. And that's why it's so important that we have under UN, for example, these kind of discussions then, to have private sector there, and private sector open also then the ways how they change their ways. We have UN Sustainable Development Goals, and we have agreed there on that. Only working together we can achieve those targets. So that is one core thing. But then also then try to find out innovatively from outside the health, that what kind of health impacts then, for example, trying to diminish then the effects of climate change. We have during this week climate change issues here in New York. That is important. It's really costly to all the effects that makes us. But then also, Finland also is quite a big player in game industry, and we have been now with WHO has opened our eyes also for that there are ordinary games that have actually health impact.
Yeah.
So we have to be also innovative in thinking the new ways where we have and can get health impacts.
Well, I want to thank all four of our panelists, not just for an incredible discussion where we did a real tour de force of the link between health and economy, health innovation, collaboration, and concrete examples, but also recognizing that this is not necessarily a health audience, that you also kept the conversation to be high level to show the applicability of health and economy writ large across sectors. So thank you very much again to Andreas, Päivi, Tamara, and Krishna for your comments, and look forward to continuing this work at the Atlantic Council.
Thank you. Thank you.
Thank you.